Hello and welcome to today's webinar. My name is Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar, the latest in the fall leg of our 2025 webinar season. If you're new to our webinars, a little background on our group. CCSN works to connect patients, care survivors, and other stakeholder groups with decision makers in the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. This webinar is being recorded and will be available on YouTube, and a link will be provided by the email you registered with, along with a link to the slides provided with this presentation. We'll add a quick Q&A session at the end, but if you would like, put in your questions in the chat at the end. It should be at the right of your screen. This webinar was made possible by grants from AbbVie, Amgen, AstraZeneca, Eisai, Bristol-Myers Squibb, Janssen, and Merck. Is because of their continued support that we can host the CCSN webinar series, and thank them for their commitment to our educational endeavors. So in honor of both Lung Cancer Awareness Month and Radon Action Month, I would like to welcome Dr. Dustin Pearson from Evict Radon. He is one of the senior scientists in the Goodarzi Laboratory and is the research operations manager for the Evict Radon National Study. His work focuses on the biology of alpha particle exposure, as well as the study of the real-time indoor air dynamics of radon within the residential built environment. In this project, Dr. Pearson serves as the primary manager for all radon databases, masterminding the security, annotation, and analysis of our complex data sets relating to radon exposures, participant demographics, building metrics, and more. Dustin's work is currently supported by the Canadian Cancer Society. And so, without further ado, I'd like to hand over to Dustin for his talk about radon. Take it away, Dustin.
Thank you. Thank you, Trevor, and the Canadian Cancer Survivor Network for inviting me here to talk about some of the research, but more importantly, as we kick off Radon Action Month in November and Lung Health Awareness Month, radon is a very important topic and because it is the leading cause of lung cancer for people who do not use tobacco. And so we're going to talk about that today, about a little bit about my research and how that affects a majority of Canadians. So the title of the talk is What Every Canadian Needs to Know About Radon in the 21st Century, especially within our built environment. So what is the Evict Radon National Study? Well, it's a study based out of Canadian universities to understand and engineer out this leading cause of lung cancer, radon, from our homes. It's asking Canadians and people in Canada to test their homes for at least 91 days using an approved long-term tester, as well as provide a variety of metrics to understand why radon is high within a variety of our homes across Canada. So this includes a variety of universities and public health agencies, including the BC Cancer Research Institute, Simon Fraser University, as well as University of Saskatchewan, Queen's, and University of Toronto, University of Laval, and Dalhousie University, including also the Canadian Nuclear Laboratories. So we have quite a breadth of scientists across Canada that are trying to really understand this problem and figure out how we can implement solutions both at a building level, but also at a population level. So a little bit of disclosures. We get no personal honoraria, no commercial support, no consulting fees, and there's no other conflicts of interest. No member of our team profits directly or indirectly from radon testing or mitigation. All of our test kits are at cost, so that means that the science that we provide you here is not influenced by anything. We are presenting the data as it speaks to us. So where am I located? I work for Aaron Goodarzi. He's the person on the left of the screen, and we are at the Arnie Charbonneau Cancer Institute at Calgary, Alberta. We are supported by the Canadian Cancer Society, the Alberta Real Estate Foundation, Health Canada, and federal funding from the Canadian Institutes of Health Research, as well as the National Science and Engineering Research Council. And so knowing a little bit about, I was a very quick overview of the Evict Radon National Study, but we really need to put this into context, what's happening in Canada in terms of lung cancer. So what we see, based on the Canadian Cancer Society's statistics, is that Canada has amongst the highest lung cancer incidence and mortality in the world. And right now, based on the most recent numbers, we're seeing about 32,000 Canadians being diagnosed with a lung cancer every year. That's a significant amount of lung cancer cases and really points to there is a crisis in Canada. And so if we look at those cases, we can kind of break it down into a couple of categories. So for every 5 people that are getting lung cancer, 3 of them have a tobacco use history. So they have a genetic signature of tobacco use within their cancer. 1 out of 5 of those people have either smoked so little or so long ago that there is no genetic signature and their cancer is not due to tobacco exposure. And 1 out of those 5 people also has never smoked in their life, really highlighting the fact that of these cancers that we're seeing, of these 32,000, approximately 30 to 40% of these cases have no relation to tobacco use. And so that's a significant number of Canadians that are getting lung cancer from things that they are being exposed to in the environment. And so when we're trying to understand how this is happening and why this is happening, we have to look at what's in our environment and how is that leading us to getting lung cancers. So there's some of the things we can think about and are probably familiar with are things like air pollution. I know a lot of us are probably very familiar now with forest fire smoke. Of course, there's other things that we should know about, such as asbestos and heavy metals such as arsenic. But for Canadians, the leading cause of lung cancer, for those who don't use tobacco, is that of radon gas that we find within our residential environment. And so when we're trying to understand our risk from these things, we need to understand the causes and the modifiers. One is how likely we are to be exposed to something, how much of it are we being exposed to, and what is our natural susceptibility to it, and if there's a behavior that we have that might put us into a higher exposure to that thing that can cause cancer. And so when we're thinking about radon, that leading cause of lung cancer for people who do not use tobacco, radon for all Canadians actually makes up a majority of our radiation exposure that we see throughout our lifetime. This means that it accounts for more than 50% of the radiation that we see on a regular basis. And so highlighting the fact that radon is radiation, we need to understand a little bit about radiation and how that works and how it affects our body. So we can categorize radiation into a couple of broad spectrums. We have non-ionizing and ionizing. And these are non-ionizing radiation is something like radio signals, mobile phone signals, microwave signals. These are things that do not have the energy to actually affect our body. So it's not something that we need to worry about, and they don't cause cancer. What does affect our body is that type of radiation known as ionizing radiation. And this is things like X-rays, gamma rays, and of course, the radiation that comes from radon. But within the ionizing radiation types, we have another set of categories that are really important to understand. And what I'll just highlight here is that the radiation that comes from radon is a type of radiation known as alpha particles. And this means is that their ability to ionize is extremely high, and they do this on the very first thing they hit. Whereas gamma rays, the thing that created the Hulk, for example, the ability of gamma rays to ionize is actually very low, and it can go through a lot of things before it loses energy. So when we think about our health and how that affects us, alpha particles, the type of radiation that comes from radon, is far more effective at causing damage in our body compared to that of gamma rays. So let's understand a little bit about the units. One of the things as a scientist is we have to talk about units and we have to understand them. So now you're getting a quick science lesson. So when we think about the units of radioactivity, there's a big unit that we call the becquerel. That's the number of events per second. So if you were to think of yourself as a famous scientist sitting underneath a tree, what we see here is that it's the number of apples that fall from that tree every second. That's the becquerel. Now the gray is the number of apples that hit us. And this is a relative dose. So the larger you are, the smaller your dose. But what we're really interested in the medical community is that of the sievert. And that's the number of apples that both hit us and hurt us. But when it comes to alpha particles from radon, every apple that hits us hurts us. And so knowing a little bit about radiation, we also need to understand that when it comes to cancer, radiation is all about dose. How much radiation are we receiving throughout our life? So if you were to think of one apple, in this case, as something we all should be getting on a regular basis, a dental x-ray. That's a little bit of radiation, and it's something that your body can deal with actually very well. The benefit to cost ratio is extremely high, so please go get your dental x-ray. Your body will thank you for it, and so will your teeth. Now, about 10 dental x-rays, that's the same as a chest x-ray. That's a little bit more radiation, but you should get it done when it's being asked. Now, 1,000 dental x-rays, that is the same amount of radiation that you will get from an upper body full CT scan. Now, this is a significant amount of radiation and is associated with an increased risk of cancer in your lifetime. Now, multiply that by 40, and that's the amount of radiation that was coming out of the Fukushima Daiichi nuclear reactors back in the nuclear disaster of March 2011. Now, that's a significant amount of radiation coming out every second, and the workers that were immediately exposed to this amount of radiation had a significant increase in their lifetime relative risk of getting cancer. So again, radiation is about dose, how much. And so when we think about radon, we need to understand what it is. We need to understand that it is radioactive. And it's also important to note that radon is actually a natural element. It comes from the ground. It comes from soil, uranium and radium in the ground. And as it diffuses upwards, it releases its radiation known as an alpha particle, as I mentioned before, that moves at 15,000 kilometers per second with enough energy to physically dent bulletproof plastic. So that's a lot of energy, and you can imagine if you're breathing that in, that's going to significantly impact our lungs. So normally outside, what happens is that radon diffuses out of the ground. It is carried away by the wind into a really low concentration, and that amount of radiation no longer affects us because we don't have a high dose. However, we like to live in these boxes that live on top of the soil that can actually capture and contain radon to extremely high levels, and that dose is increased to a point where through chronic repetitive exposure, we're going to increase our cancer risk over time. And we know this happens because we can follow the gas migration from underground fissures, and then our houses, we can measure that using long-term tests. So where did radon, how did we discover radon? This is a very short history, and I think it's actually quite interesting, largely because it was a Canadian discovery. This fellow here, this is Ernst Rutherford, back in 1899, wrote about radon, and you can see here, he says that there can thus be little doubt that the abnormal activity observed in caves and cellars is due to the radioactive emanation present in the earth, which gradually diffuses to the surface and collects in places where air is not disturbed. So we've known about radon for over 100 years. And what was also interesting is that a trailblazing woman in science, Harriet Brooks, was his graduate student at the time, and she was one of the co-discoverers of radon back in 1899. So we've known about radon for over 100 years, but it was in the 1940s where this fellow, Wilhelm C. Huppert, actually collected over 300 years of radon exposure data from miners who worked underground. And what he found based on all this data that he collected was that radon caused lung cancers at more than greater than 50% of the workers after 10 to 20 years of employment. So he showed back in the 1940s that exposure to radon caused lung cancer. So we knew this since the 1940s. However, I'm not sure if you're aware, at the same time, in the 1940s, they were developing the atomic bomb. So actually, the release of this information was blocked because they didn't want the public to fear radiation. Let's move ahead a little bit to the 1950s and the 1970s. So we've known about radon for 100 years. We've found out in the 1940s that radon is linked to lung cancer, but it wasn't until the 1950s to 1970s in Elliott Lake, Ontario, where we've seen an occupational link between radon exposure and having double the expected lung cancer rates in these miners. And so there's this obelisk here in Elliott Lake to the miners of the uranium mine. And so it's just a reminder that we have a gas that we can be exposed to that is causing lung cancers and is killing people at an abnormally high rate. And then we've seen this not only in Canada, but we've seen this in the US, Eastern Germany at the time, Russia, and of course, France. So knowing that there's a link between lung cancer in an occupational setting, and it wasn't until the 1980s where we discovered actually radon isn't only a problem in underground mines, it is also a problem in our homes. So this family here was the Watrous family. So the story goes is that Stanley Watrous was a nuclear power plant technician back in the mid-1980s at the then under construction Pennsylvania Limerick County nuclear power plant. So when he would go into work after just moving into his brand new house, they had installed radiation detectors at that time, but there was no nuclear material on site. And so what was interesting was that when Stanley came in, he'd actually set off these radioactivity detectors, suggesting he was covered in radioactive material. But when he went home, he would not set these detectors off. And so that piqued the interest of the security people at the nuclear power plant. They followed him home. They ended up testing his house for radiation, and it came back at a whopping 99,900 becquerels per meter cubed of radon. That's a lot of radiation and is equivalent to over 10 million dental x-rays worth of radiation exposure. Thankfully, the Watrous family immediately moved out of that house, and now he is actually a retired radon mitigator. So interesting story, and that's how we found out that radon is a problem within our residential environment. Of course, you might say, well, that was in Pennsylvania, US, that's not really a problem in Canada. Unfortunately, we've seen homes that are higher in radiation in Canada at 103,000 becquerels. So this is not unique to the US. We see this in Canada as well. And so it's something that we need to take note of and start measuring our houses for. So the question still remains, well, okay, we see the impact, we see there's a link between radon exposure and lung cancer, but how does it actually affect our bodies? And so being a radiation biologist, now you're going to get a very short lesson in biology. So what we have here is something called a DNA karyotype. We have 23 chromosomes, one set from mom, one set from dad, and when you are born, there you have nice intact DNA, the very genetic code that makes you you. But as you move through life, your DNA gets damaged and it forms a mutation, which what increases our chance of getting cancer. And so what happens is that as radiation, the alpha particles from radon hits our cells and damages our DNA. Alpha particles being that high ionizing, that type of radiation that can cause a lot of damage. What it does is it damages our DNA to an extremely high extent, full of a bunch of different types of DNA damage that our cell actually has an extremely hard time putting back together and is extremely mutagenic and increases our chances of getting cancer. And so what we see here in this DNA karyotype is this healthy cell, in this case from a girl cell, and in the same person, we've taken a cancer cell and we've looked at their DNA, and you can see that some of these chromosomes have multiplied, some of them are completely lost, and some of them are completely unrecognizable. And so when we try to understand how cancer is being caused, we have to understand that when we get mutations and genetic instability, this is what can lead to getting cancer, and the radiation from radon is really good at causing this genetic instability. And so because of this, because of our understanding of how radiation affects our DNA, the International Agency for Research on Cancer has classified radon as a group 1 carcinogen. That means we understand how it works on a biological level. We have the data for human exposure to getting cancer, and we've seen it in animals as well. And so that we absolutely know radon causes cancer. And we've seen this, like I said, in humans when we looked at lung cancers versus not. And so what we see across several large studies across North America, Europe, and China, looking at 10,000 people who had lung cancer and 10,000 people who have not, we looked at their radon levels. And what we saw was that for every 100 becquerels per meter cubed of radon exposure, you have an increase in your lifetime relative risk of getting lung cancer of 16%. So that's a significant amount, and this is something that we can actually measure within our homes. And we continue to find this link even today across many more people and much greater amounts of data. So this link between radon and lung cancer is quite strong, and we continue to see it. And just to really underscore this point, it's the radiation that is coming from radon that is really good at causing cancer. So what we have here is a graph of radiation dose versus cancer risk, and we have the two types of radiation: particles that would come from radon, and photons such as gamma rays. And so for a small dose of photon radiation, your relative risk of getting cancer is actually quite low. But for that very same dose of particle radiation, our cancer risk is significantly higher, underscoring the fact that this type of radiation that comes from radon is extremely good at causing lung cancer. So now that we've highlighted the link between radon, its health effects, and how that causes cancer, let's get into, I think, the more interesting bit. Where is it? Where are we being exposed to it? What can we do about it? And how can we test it? And so primarily within Canada, where most Canadians are being exposed to radon is in our buildings. So like I mentioned before, we like to live in these boxes that live on top of the soil. And every home lives at a negative pressure where it actually pulls in air from the lowest point in the home. And so what we see here is we put a tracer gas in the soil outside of a home, and this home is actively drawing in this tracer gas on a regular basis. And so our homes are actively pulling in air and soil gases from these gaps and cracks in our foundation, and including a slab on grade home, and pulling in radon gases to such a level where we can be exposed to high levels of radiation. But it's not just the fact that we live on top of soil. We have to have three separate components for us to have a radon problem. The first is that our location, the second is that of our built environment, and the third is a behavior that puts us into the home and exposes us to more radiation. So let's look at the first one. Region matters across Canada in terms of our exposure. So if we look at Canada overall, the average radon exposure is 84.7 becquerels per meter cubed. But when you break that down, what we see is that approximately 1 in 5 homes, or 17.8% of homes, are above Health Canada's limit of 200 becquerels per meter cubed. But more importantly, over 40% of the homes are above that 100 becquerels per meter cubed, where we begin to see a lung cancer risk. Now, if we look across the different regions in Canada, in coastal BC, for example, 1 in 75 homes are above Health Canada's limit of 200 becquerels. In the BC interior, this risk jumps significantly to 1 in 3. In the prairies, it's 1 in 5. In Ontario and Quebec, it's 1 in 6. And in the Atlantic provinces, it's 1 in 3. So what we see here is that wherever you are across Canada, there is a risk of having high radon within your home. But what also matters is the type of community that you live in. Whether you live in an urban or more rural isolated property actually comes with a distinct risk of having high radon. So what we see here is that in a city, for example, a large town of over 100,000 people, we see on average an average radon exposure of 85.6 becquerels per meter cubed. But if you were to live in a rural isolated environment, the average radon is 31% higher. So showing that is, as you live in a more rural area, largely due to the type and proximity of groundwater wells. Now, I would like to highlight, this is not the fact that if somebody lives in a rural environment, it is not due to the fact that they are having groundwater in their home. It is the very presence of that water well in the ground that allows radon to saturate the soil. Now, knowing that communities matter, knowing that regions matter, we also know that buildings matter. When we look at the raw data, so what we see in this graph here is every single point is a home that has tested for radon in Canada. Approximately 20% are above Health Canada's limit of 200 becquerels. Now, this is based on over 70,000 long-term radon tests across approximately 182,000 Canadians. So that's a lot of data, and we can begin to understand, well, what are the factors that are causing that radon problem? Because every home is unique, whether in its age, in its design type, or its insulation factor. All of these affect how much radon we are being exposed to. And one of the primary results that we've understood is that the newer the house that you live in, the higher your risk. So what you see in this graph here is we've compared Canadian homes to that of Swedish homes. Now, back in homes built between 1950 and 1980, Swedish were actually building their homes at a slightly higher average radon exposure. But for something happened in the 1980s where that came to the same average, but as Canadians continued to build their homes newer and newer, we had unintentionally built our homes in such a way that we now have a higher average radon exposure compared to the same home built in Sweden at the same time. So this is suggesting that the way that we are building our homes actually significantly can impact our radon exposure. And we can see this trend across the types of buildings that we live in as well. So if you live in a single detached versus semi-detached versus other, what we see here is that the bungalow, for example, is the king of radon exposure. It has the largest footprint and the least amount of windows and doors for dilution points. So what we see is that the bungalow is king. And as you go to split level, multi-story, or duplex, that risk slightly decreases, including that to row houses. But we see this across community types. This trend is consistent across whether you live in a rural, very isolated area or a small town or large town, suggesting that our building type has a significant effect on our radon exposure. But one of the other ingredients, the key ingredients, is that of our behavior, and including our occupation. These things affect how much radon we are being exposed to throughout our life. Now, one of the very first things to note is that the younger you are at age of exposure, the higher your lifetime relative risk of getting lung cancer from radon. And that's simply because the younger you are, the more life you have left to live, and the higher the dose you're getting because you're a smaller person, as we saw before with the units of radiation. So we know that radiation is about dose, and if we're trying to understand risk, we need to understand how much dose is a person getting. So we have this complicated formula, but we can break it down very simply into how much radon is in the building and how much time are people spending in their building in order to understand our cancer risk. So we asked the people that have been participating with the Evict Radon National Study, how much time are they spending within their primary residence, different residence, or outside? And what we see is that for the average Canadian, we're spending approximately 84% of our life indoors. Now that's a significant amount of time where we are breathing in indoor air and potentially exposing ourselves to a high amount of radon unintentionally. And the type of work that you do can actually affect how much time you're spending at home. If you work away in an office building, of course, you're going to spend less time at home, lowering your radon risk from your home environment. But if you do work from home, are retired or on leave, the amount of time that you're spending in your primary residence is higher, increasing that amount of radon that you're being exposed to on a regular basis. So this makes sense. And so understanding how much time we spend in the house and how much radon you have in the house, we can now begin to understand how much radiation dose you are getting. So for the average Canadian is getting 3.6 millisieverts per year, but the global average is only 1.2 from radon. And now that's already 3 times higher just by the fact that Canadians are living in homes that can have high radon. And what's really interesting is that approximately 5% of the people that we have tested for radon over the last 10 years, they're getting enough radiation just by living in their home that it's more than an astronaut on the International Space Station. So what this really suggests is that our homes can be quite a high environment for radon exposure and increase our lung cancer risk due to that radon in the house. And so when we look at Health Canada's numbers, we see that 16% of lung cancers in Canada are due to radon, and that equates to approximately 1 lung cancer being diagnosed in Canada every 108 minutes. And this is less than every 2 hours. Now, I know that seems like a really scary number. However, everything is going to be okay. And that's because radon is one of the most solvable cancer exposures that you can have. And that's because we can test for it and we have a solution to fix it right away. So if you test for radon and you get your results and they're low, you celebrate, you continue on. And if you get your results and they're high, you can fix it. And so what fixing is something called sub-slab depressurization. And all that consists of is essentially a pipe that they drill into your lowest foundation floor, and they put a fan on top of that to then pump out the soil gases from underneath the house and outside the house. This is extremely effective. So what we have here Our homes, some homes in this case, have tested for over 3,500 becquerels per meter cubed. After mitigation, they were below 100. So this is suggesting that and showing that mitigation is extremely effective. And we can see this in real time. So what we have here is a real-time radon device measuring radon every hour. On the day that this person turned on their radon mitigation system, radon flatlined. So really showing that these devices work and we can see it in real time. Now in Canada, we have something called the Canadian National Radon Proficiency Program, or C-NRPP. This is a certification body that exists within Canada to ensure that the professionals know what they are doing. So if you're going to get a mitigator to come to your house, you should ensure that they are CNRPP certified. Now, all of this leads to the question of when should I test? And there is an old saying that the best time to plant a tree was 20 years ago, but the second best time is now. And you can simply switch that to the best time to test for radon. The second best time is now. So how is radon measured? How do we understand how much we're being exposed to? Well, that's using something called an alpha track detector. And so our study uses this Radnova RadTrack 3, and what it is simply is a piece of impact-resistant plastic, CR39. And as the alpha particles from radon diffuse into this detector, they leave physical dents. And so after 91 days, we can go in and we can count the dots and we can give you a very accurate reading of your radon in your house. But what is a reliable reading? Well, one of the ideas that exist within the radon field is that your house is highest in the winter and lowest in the summer. We wanted to test this. So what we have here, this is a real-time radon plot. You can read it like a clock, where 12 noon is January 1st, and as you read it clockwise, that goes across the year. And so in this house, it is what we consider a high winter, low summer, because the winter is high and the summer is quite low on average. However, this was only 25% of the homes that we've tested. Another 25% of the homes were actually higher in the summer than they were in the winter. And another 50% of the homes were consistent all through the year. And so what this is suggesting is that you can almost test all year round. But our recommendation is if you want to test for only 91 days, test between September to March. If you want to test for across the summer, for example, you're starting your test in April and up to August, please test for 180 days to capture a little bit more. And so the next thing is, well, how long? So I just mentioned 91 and 180 days. And you might be asked, why can't I just test it right away? Well, we saw in those last graphs that radon fluctuates very, very highly. And we can look at how much radon deviates from the annual average. So what we have here is real-time radon data. And what you can see here is that if you're only testing for an hour, 1, 3, 5 days, for example, if you only test for this short period of time, you could actually get a radon result that is artificially high or artificially low compared to your average radon across a year. And so what we see is that if you test for 3 to 5 days, you could come back, you testing for a time where it's abnormally high. You could decide, oh, I need to fix this. You pay for mitigation, when in fact your average radon was low. But the opposite can be true, where you're testing for a time where it's naturally low, and you could decide, oh, I don't have a problem, but in reality, the average radon was high, and so you're exposing yourself to more radiation than you thought. So the best thing to do, based on real data, is to be testing for at least 3 months. And again, if you're starting your test between the months of April to August, do that test for 180 days. And so there's many different variety of tests on the market to test your home for radon. The one that we use is the RadTrack 3 from Radnova. It's an internationally certified device. And there are a variety of real-time electronic devices on the market. The one thing that I will vehemently tell you to stay away from is that of charcoal detectors. So these are type of detectors that you can pick up at Canadian Tire or Home Depot or other big box stores. The problem with charcoal detectors is that they're short-term, for one thing, so that's what you don't want to do. And two is that they can be easily tampered with. So stay away from charcoal detectors. They're not approved by Health Canada. Stick to the things that are approved by Health Canada. And where can you get a test? Well, there's Health Canada sponsored Take Action on Radon, where they list a variety of test providers. Our study is listed there as well. You can get a variety of approved devices from the Canadian National Radon Proficiency Program. And of course, our study provides at-cost radon test kits where your data will go to helping us improve policy, building codes, as well as understanding lung cancer risk. There's one thing I will say is that not all electronic devices are equal. What we have here is a graph provided by Health Canada, and they've recently recalled over 12 devices that you can find on marketplaces. And so what they saw is that there are a variety of electronic devices on the market that actually are random number generators. Over 50% of the ones that they tested failed. So if you're going to get an electronic device, please make sure it's approved by the Canadian National Radon Proficiency Program or Health Canada. And this is just to show you that Health Canada has actually put out recalls for over 12 devices. So please take a look if you're going to get an electronic device. Now, you can get a citizen science kit from the Evict Radon National Study. That's an at-cost device, and your data will go to helping us understand radon exposure. And so what does that look like? Well, first of all, we've created a knowledge series. So if you follow us on Instagram, Facebook, and Twitter, you can see all of the knowledge that we've gained over the years. We've put into little bite-sized things on our socials. So you can follow us there. And we've also created a variety of blogs that you can look at on our website. But more importantly, we're using this data on a regular basis to understand exposure across Canada. So the last time that Canada has had a national report put out was that in 2012. This was put out by Health Canada, and it looked at radon across about approximately 14,000 homes. But working with Health Canada and the BC CDC, our study put out an update to this report in 2024 using 70,000 long-term tests, and that's what the numbers that you saw were based on today. So if you want to see that report put out by Health Canada and ourselves, you can go to crosscanadaradon.ca. And so the question might be, well, what's the dose of radiation that I'm getting from radon? Well, we've created a little calculator on our website where you can put in a variety of factors, including your radon level and how much time you're spending in your home, to see a predicted exposure rate and increase in your lung cancer risk. So what we have here is just a screenshot of this calculator where we ask, how many homes do you live in? Do you work at home? Or do you work away from home? And how much time are you spending in your house? And how much radon is in your house? If you're not sure, you can actually click on unsure of my radon levels, and we have averages for homes that we have measured across the years. And so, for example, if I was doing this particular test, I've lived in one house. The amount of time that I spend in my home is different across the weekends versus the work days. And my average radon is 200, for example. The amount of time that I spend in my home in a 24-hour day is 16 hours versus a weekend, it's 22. And I've spent approximately 10 years in that home, and I go on vacation every 4 weeks, for 4 weeks of the year. And so what this will get back is the amount of radiation that I'm being exposed to through a year, every year, 8 millisieverts per year, and the total exposure over that 10-year period is just a multiplication of the years. So we see 80 millisieverts. And what that shows is that my average lung cancer relative risk is increased by 32% over my baseline. And just by living in my house for 1.1 years, I'm receiving the same amount of radiation as somebody getting a full CT scan of the abdomen, pelvis, and spine and heart. And so this calculator just helps to contextualize the amount of radiation that people are being exposed to. We will be updating this calculator in the future with what if, for example, if you're a smoker, if you're younger age of exposure, and if you had other lung infections such as tuberculosis or lung inflammation, these all affect your cancer risk. And so we want to begin to update this to be a more sophisticated calculator. So what's the next steps? Knowing that we have a lot of data and we want to do some good with it, what can we do? Well, I was just at the Canadian Cancer Canadian Cancer Research Conference. This is a large conference collecting cancer research across Canada. And at that, the Canadian Cancer Society unveiled their new lung cancer action plan for 2026 to 2035. And what they did in this action plan is highlighting the steps that they want to take to see a reduction of by 30% in lung cancer mortalities in the next 10 years. And then the first priority is that they want to have Canadians reduce their exposure to inhaling carcinogenic things such as radon. And so they highlighted here in their action step 3 that they want to have people test for radon across areas of Canada that are high for radon, such as most of Canada. But the other thing that they want to do in their action plan is to detect lung cancers earlier. The best thing that we can do right now in modern medicine is detect a cancer early so that we can treat it and get it before it spreads across the rest of our body. And they've highlighted that here. So how can we help as a scientific study to enabling this? So right now in Canada, we have lung cancer screening programs. These are great programs that use something called low-dose CT technology. So using a small amount of radiation, we can take images of the lungs and look for cancers at a very early stage. But in order for a person to be eligible for these early lung cancer screening programs, they have to meet a certain set of criteria. This criteria includes being an age between 55 to 74 years old, and being a current smoker or a heavy smoker that has quit within the last 15 years. But on top of this, they need to have an exposure of 10 to 30 pack years of history, of smoking history. So for example, if a person smoked 2 packs per day over 15 years, that would be a 30 pack year history. Now that's a significant amount of tobacco use, but as I showed at the very beginning of the presentation, that misses approximately 30 to 40% of lung cancers in Canada. And so really the question is, knowing that radon is a leading cause of lung cancer for people who do not use tobacco, how can we get radon into the criteria of these early lung cancer screening programs? Because right now it is not. And you might say, well, you just need a radon test within your home. But the problem is that if you test your current home for radon, that is only one place that you've been exposed to radon in your lifetime. The average Canadian moves every 5 to 10 years, and so testing your one home doesn't look back across the history of your life exposure to radon. It's actually fairly easy for a person to report how much tobacco they've used throughout their life, but it is essentially impossible for you to know the radon level that you've breathed in across all of your work environments, all of your homes, and all of your friends' homes throughout your life. And so really the question is, how can we have a measure of your lifetime radon exposure? Well, the answer comes in a study that we just released only last month. And that comes from the fact that when you breathe in this radioactive gas radon, it actually turns into solid lead, radioactive lead. And this lead has a 22-year lifespan in your body. And so what that means is that we're releasing more radiation as you breathe in these solid particles. You're being exposed to more radiation in your lungs, but also your body is holding on to all of the lead it's been exposed to throughout your life. And it only releases about 30% of that lead into things like your toenails. And so what our study did was we took 67 people who we've tested for radon, and we asked them for their toenails. And using their toenails, we measured the amount of lead in them, and we've linked that now to radon levels and the amount of lead in their toenails. And so the next step is we need to ask 10,000 Canadians to give us their toenails. I know it sounds a little weird, but we'll be giving them a radon test kit as well as a toenail collection bag so that we can understand, well, what's the risk increase for getting lung cancer based on the amount of lead in your toenails? And if we can be successful in this next phase of our study, we'll be able to get Canadians into early lung cancer screening programs who have never used tobacco but have a high lifetime exposure to radon. And so if you want to be a part of this study, here's the link. It's evictradon.org/additional-radon-studies/. And sign up, take our eligibility survey, and if you're eligible, we will be in contact shortly. So using this data, now we want to approach lung cancer from a very holistic manner. So we've been funded by the Canadian Cancer Society breakthrough grants on changing the narrative of lung cancer to improve prevention for non-smokers. And so this includes looking at things such as pollution in our air, radon in our homes, as well as heavy metal exposures in the Atlantic provinces. And so we'll be using data from CanPath, our Canadian Partnership for Tomorrow's Health, and testing them for radon, testing their toenails, and as well as air pollution and heavy metals to really form a holistic understanding of lung cancer in people who do not use tobacco. So with that, we've published many open access articles based on this data. Everything is available on evictradon.org/publications. If you have any questions, you can email us at info@evictradon.org. And I thank you for your time, and I welcome any questions you might have on this information and other things that you want to know about. So thank you very much, and I'll give it away to Trevor and the questions.
That fantastic presentation. That was a fantastic presentation throughout, and very eye-opening as well, especially considering the new research that's come to light. I had no idea that it turned to lead in your lungs. We do have a question, but if you would like to put your questions in the GoToWebinar tab, more than welcome, especially for this. And also, as a side note, Dustin and I recorded a podcast earlier this year about certain things. So if you'd like to get a supplementary of the information we discussed here today, head on over to our website to our podcast area. First comes from Natalie. Does radon come from all soil rock, or are there some soil rock types that are less harmful?
What we do see across Canada's geology is there are pockets of Canada that have higher concentrations of uranium and radium. For example, the prairies in the interior of BC, and we do see that play out in our relative number of homes that are high for radon. So we do see that, for example, interior BC is 1 in 3 homes above Health Canada's limit of 200. In the prairies, it's 1 in 5. In Ontario and Quebec, little bit less, but again, when you think about one region, we don't see a huge difference within a defined region. So if you look at southern prairies, for example, the biggest predictor in the southern prairies is not what province that is, it's actually the type of home, because the type of home is the greatest thing to capture that soil gas. In coastal BC, they have a lower concentration, for example, of uranium and radium in the bedrock and the soil. Some radon still gets out. So we do still see, even though it's a much lower prevalence, we do still see homes that can capture radon to really high level. And so ultimately, I do defer back to Health Canada's advice, and that is, there is no way to know absolutely how much your radon level is unless you test. You can do all the predictors in the world, but it's so easy to test, and it'll tell you for sure exactly how much radon you're being exposed to.
Mm-hmm. And just for clarification to everyone, yes, this is being recorded and will be made available at the address that you have registered with. One very important question from Kay: where should you place the radon tester in your home?
That's a good question. Health Canada's advice, and ours as well, for the study is you should be placing that tester on your lowest regularly occupied level, where a human spends at least 4 or more hours a day. So for example, I have a basement and I have 3 small boys, and they love to play in the basement for 4 or more hours a day. So I'm going to be testing that basement because that's where I want to know how much radon is on average. If you don't spend any time in your basement is undeveloped, and you only do laundry there every other day, don't test it there, because you want to test the air that you are breathing regularly. In terms of cancer risk, what is most important is what you are breathing in on a regular basis. All homes experience some degree of air mixing, and so we see that even if your main floor is an average is high, your basement's going to be high. If your basement was low, your main floor is going to be low. So just test where you are spending the most time.
Mm-hmm. My final question for today, because we are running out of time, but final question for today. Where would you, could we send toenails for analysis? And if you talk a little bit about the new initiative.
Sure. So I will ask, people don't just unsolicitedly send in their toenails. As much and as wonderful as that would be, we have a process by which we want to collect the toenails. So right now, if you sign up through our eligibility survey and you are deemed eligible, we will send you a toenail test collection kit that consists of 4 small baggies. We need start and end dates, and we need 4 months of tests of toenails. So it's not just a one-time clipping. We actually need a lot of toenail, however gross that might sound. But we need that because there's such a small amount of that lead from radon. We need enough to be able to measure it properly. So through our study is the very short answer to that.
Excellent, and we'll have a link in the webinar description about where you can get that. So once again, thank you very much, Dustin, and thank you very much for that presentation. Very insightful, and hopefully definitely something that we can shine more of a light on, especially considering the prevalence of lung cancer in this country. So thank you very much for that presentation.
Thank you. Yeah, pleasure to be here.
Excellent. Now, this webinar was made possible by grants from AbbVie, Amgen, AstraZeneca, Eisai, Bristol Myers Squibb, Janssen, and Merck. It's because of their continued support that we can host the CCSN webinar series, and thank them for their commitment to our educational endeavors. Now, this is one of a series of webinars that are being presented this fall. Our next one is happening next week, so to stay in loop about webinars, visit our website or check your email for our e-blast. If you're not seeing our emails in your inbox, check your spam folder because we do use a third-party email service. Make sure you are subscribed to our newsletter on our website to not miss what we are doing here at CCSN. And just a reminder that all webinars can be found at survivornet.ca or on CCSN's YouTube channel. So with that, I hope everyone has a fantastic evening, and we will see you on the next one.